Hey guys, so we're going to go over the acronyms OPQRST and SAMPLE in this video. So this is going to be the foundation piece and benchmark for the majority of our medical assessments. OPQRST is just a simple acronym used for you to remember how to investigate a chief complaint and kind of get an understanding of what the patient is going through. OPQRST is best used for patients that are suffering from pain, but they can be modified for other assessments as well. So the acronym is onset, provocation, quality, radiation, region, and reoccurrence, severity, and time. So when we ask onset, it's as simple as, sir or ma'am, what were you doing when this started? P, provocation, is there anything that makes this pain better or worse? This could be sitting, standing, moving, or resting. Quality is going to ask them what the pain feels like. When we ask these questions, it's very important for us to not give them any adjectives in the beginning. We can't ask them, so do you have crushing chest pain? We want to use open-ended questions. So, sir or ma'am, what does your pain feel like? Give them a couple seconds to come up with their descriptive word, and then if they are not able to, that's when we would input all of our descriptive words. Is it a pinching, a pulling, a throbbing, a burning, a ripping, a tearing, or a pressure-like sensation? Radiation, region, and reoccurrence. The best way that I like asking this question is I will say, ma'am or sir, can you point with one finger where your pain hurts the most? They're able to point or pinpoint exactly where the pain source starts, and then you would ask them, does your pain move anywhere? So that is the region, and then radiation is the movement of where it goes. And then we could always ask for reoccurrence if this has happened before, or if this is a new pain that they've never experienced before. You have your severity, ma'am or sir, on a scale of 0 to 10, 10 being the worst pain of your life, how would you rate your pain? And they'll give you on the scale of 0 to 10 what their pain is. And then time, ask them, what time did this start? Or when did this start? If they give you a minute amount, if they say, oh, about 15 minutes ago, confirm with your watch what 15 minutes ago it was, and then confirm the time with the patient. So if they tell you 15 minutes, look down at your watch, say, oh, so about 2:30, and then they'll confirm that their pain started at 2:30. So you have a hardline time on when that started. So SAMPLE is going to be the acronym that we use to obtain the patient's medical history. We have signs and symptoms, allergies, medications, pertinent past medical problems, last oral intake, and the events prior to or leading up to the incident. So signs and symptoms are going to be what the patient is experiencing or causing their medical complaint. Signs are going to be something that you can see, and a symptom is going to be something that the patient is describing to you. We're then going to ask the patient if they have any allergies to medications. We're going to ask what type of medications that they're taking, and then we need to ask any pertinent past medical problems. So that's a mouthful, and a lot of younger or newer EMTs will ask, well, sir, do you have any pertinent medical problems? The best way to ask this is, sir or ma'am, do you have any medical problems? Or do you have any high blood pressure, lung problems, heart problems, ever had a stroke or a heart attack? We just do these big generalizations in order for us to umbrella or catch any of the big things that might be hurting them or harming them. We have to ask their last oral intake. So we'll ask them when the last time that they ate, and then the events leading up to the incident. So what were you doing when all of this started?